In today's society, suicide is often seen as a very controversial and cynical topic that people often refrain from speaking about in everyday conversation, although it is important that we discuss our mental health and possible thoughts of suicide with others. In addition to speaking about it, it is also crucial that we are exceptional listeners to any loved ones that are dealing with difficult situations concerning their lives as well. As we listen, it is our job to make sure that we display an appropriate reaction to such extreme news. All in all, family, friends, and other acquaintances should respond to someone with suicidal tendencies in a calm manner by offering emotional support and helping them seek therapy or other professional treatment. Loved ones of a person at risk of killing themselves should be willing to provide them with emotional assistance. When talking about the suicide statistics of minors in his editorial, Reducing Adolescent Suicide, Yale School graduate Michael Block states that successful interventions to reduce the adolescent suicide rate must focus on reducing risk factors for suicidal ideation and depression, for example, depression, alcohol use, and promote protective factors to decrease this, for example, increase parental and peer support. In order to try to prevent someone from actually potentially harming themselves, family members and friends must be there for them to lift them to higher ground and show them that they are not alone. They may do this by convincing them that, instead of using unhealthy coping mechanisms like substance abuse, they could try vocalizing how they feel. From here, the loved one can give them support by talking them through their problems and assuring them that everything will work out in the end. Furthermore, in an article found in Counseling and Psychological Services entitled Depression and Suicide, the author mentions the different factors that lead to one's desire to kill himself, stating that a major cause of suicide is mental illness, very commonly depression. People feeling suicidal are overwhelmed by painful emotions and see death as the only way out, losing sight of the fact that suicide is a permanent solution to a temporary state. If people were less overwhelmed by such intense emotions, suicide rates would most likely rapidly decrease. Those that know of someone that is experiencing such feelings are responsible for helping them control these emotions and explore new ones that are less painful. This will distract them from the feelings of suffering that they are experiencing and allow them to acknowledge that what they're going through is not permanent. In addition to being there for emotional guidance, close friends and family members of victims of suicidal thoughts should also help them seek therapy or professional help. After analyzing the different treatments for mental health disorders in her article Dissociative Identity Disorder, Dr. Paulette Marie Gillig claims that a cognitive behavioral therapy approach is often recommended that incorporates communicating effectively with the alters and helping the patient find more adaptive coping strategies. This can be enhanced by teaching relaxation exercises, suggesting breaks from the setting for a few minutes, and helping the patient gain control over cognitive distortions of the self and world. Therapy is strongly suggested by doctors to help those suffering from mental issues cope with their feelings in a safe and healthy manner. Family members and friends must encourage their struggling loved ones to get outside help, as they most likely won't be willing to get therapy on their own and won't be able to seek the proper help they need. Likewise, when discussing the different methods that exist for enhancing mental health, the American Foundation for Suicide Prevention claims in their article entitled Treatment that research shows that teaching healthcare professionals to recognize and treat depression is an effective way to reduce suicide rates. Because that is a proven fact, we focus here on how depression can be treated, both with medications and psychotherapy. The amounts of suicides that occur could dramatically decrease with the help of mental health experts and therapy with a psychiatrist. Loved ones of those with suicidal tendencies should encourage them to seek such help and convince them that professional treatment could have many positive impacts and ultimately benefit them immensely. It is their job to persuade them to not be afraid to get outside assistance, regardless of how much they may refuse to at first. On the other hand, some may claim that family members, friends, and acquaintances should not take any action in regards to the news of loved ones having suicidal tendencies, as they believe that in certain cases, their suicide may have more positive than negative effects. In his article, Can It Be Right to Commit Suicide?, medical doctor Burden Neal claims that a person does no harm in committing suicide, but merely ceases to do good. In some cases, a person may have become a burden to society, and so may actually do most good by committing suicide. Although some people are known for doing more harm in the world than good, this is never a valid excuse to claim one's suicide is justifiable. Under no circumstances is this reasonable, because no matter how much wickedness one has brought into the world in the past, they always have the opportunity to turn this around and do more good for society to terminate their legacy of evil. Family members and friends of someone that identifies as suicidal should never refuse to acknowledge their situation, no matter how sinful that person may be. In sum, loved ones of someone that is at risk of harming themselves should react calmly to the news of their harsh thoughts and should take action to prevent such consequences, including providing emotional support and motivating them to get professional help or therapy. By stabilizing one's emotions and convincing them to get help from an outside source, we can help them realize that there is more in life and that whatever they are going through now is only temporary. Perhaps if we attempt to take extra precaution against mental health issues in the future, suicide rates will decrease and the world will be a much happier and healthier place.